Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Aaron Karn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along. Dr. Samreen Vora here, and on today's episode, we have Dr. Isabel Gross. Dr. Isabel Gross is an associate professor of pediatrics and a pediatric emergency medicine physician at Yale University School of Medicine. At Yale, she serves as the director of pediatric simulation, teaching all learner levels across the university and hospital system. She is the chair of the International Network for Simulation-Based Pediatric Innovation, Research, and Education, INSPIRE. Together with her colleagues, she co-founded the AI Healthcare Simulation Collaborative. Dr. Gross is an established simulation-based researcher and research mentor for her international colleagues. Her simulation-based research focus is on distance simulation, international outreach simulation, and the explorations of new approaches in simulation-based education, including artificial intelligence. Hello, Dr. Gross. I am excited to have you on our podcast.
So excited to be here, Samreen.
I know we've been trying to plan this for a while.
We have.
So it's good to be here and start chatting with you. Part of where this idea came from for this podcast was from INSPIRE and wanting to continue and increase our collaboration between IPSS and INSPIRE. I know that those two organizations have really been closely connected for a long time. And I know that you are currently the chair of INSPIRE.
Yes, it's been a really, really amazing journey for me. I feel like I'm almost like a child from INSPIRE because when I was a resident and started with INSPIRE 2015, I could have never imagined that I would be the current chair. INSPIRE is a pediatric research network where we offer mentorship, foster projects, support programs of research, and sometimes programs of research can even be born out of INSPIRE, which is quite exciting.
That is really exciting. I think we also have like a joint fellowship with INSPIRE, IPSS does.
Right, that I found.
And I think you were exactly. That's right. That sounds like, and that you were a big instrumental part of getting that off the ground. And you mentioned a lot of projects that are born out of that relationship and out of INSPIRE itself, which often will have their meetings right before our IPSS meeting and as well as, other sim meetings. So can you share maybe a specific project or some of the ways it's affected your career or projects that it has kind of made connections for you with as you've been part of INSPIRE and IPSS over the years?
Of course. Let me think. I would say the best example would probably be the Healthcare Distance Simulation Collaborative, because that was born out of not only INSPIRE, but also IPSS. When the pandemic came.
And also out of the pandemic.
Yes, the pandemic. Oh, goodness. I remember, maybe you guys remember this too, when the pandemic first hit. I wasn't sure if I want to just be paralyzed on my couch or if I want to really make this into something meaningful for everyone. I had at the time already been doing simulations at a distance globally, internationally. So I had a little bit of a head start, I would say. And then there was so much need for distance simulation. Yeah. So together with Janice Pelaganas from Boston, we co-founded the Healthcare Distance Simulation Collaborative. In that collaborative, we work with IPSS and INSPIRE initially, and then with many other societies on really setting a research agenda, figuring out nomenclature around distance simulation. That used to be a very novel concept, and most people actually refer to it as telesimulation. It's okay if you still use that term, or virtual simulation, which seemed to be confusing.
Yes, exactly.
So we had several working groups, one working on pictography, how can we actually express what we're doing. We had summits. We had a total of, I want to say 4 or 5 summits, I'm not exactly sure. The collaborative is still ongoing and now focusing more on the global aspect, because maybe that resonates with you guys as well. A lot of us have really returned to in-person simulations.
I think the part that's really cool, I know you said Inspire is focused on research, and this collaborative that you had established was really setting a research agenda and also even sharing where it is now in the global space. And it's still something very valuable. So it wasn't just research, but it was really helping people, one, put the right language and have some shared language around distance simulation. And what are we talking about when we talk about doing distant simulation from different spaces and who's where, and creating some guidelines around it, best practices around it, to really talk about how do we do simulation well when it's done in a different space, in different formats. And so setting that research agenda, but then also improving the science, which is what research does, right? Improving the science and moving it quite a bit forward very quickly, which is what we needed in the pandemic in so many different ways. And we happened to be in simulation. That's where you move the dial, right? I think that experience, I think was quite life-changing, the pandemic, for everybody, but also was an opportunity for a lot of people to pick up a variety of skills that maybe were unexpected. Right? I don't know that you had expected that a pandemic would happen, and
no, I did not.
Right? You create this incredible collaborative, bring people from across the world to figure out, this distance simulation concept. Can you share with me what skills do you think, in terms of simulation and your growth through that time period, that you think carried forward for you?
That's such a good question. I think for me, really trusting that sometimes things need to move quickly, even though they're not perfect.
Yes.
I'm an emergency medicine doctor, and sometimes we just have to make it work. I will say, reflecting on myself, and I guess that's where the question's also going, is I didn't know that I was capable of doing this. And maybe many of us felt that way, right?
Yeah.
Many of you guys out there felt that way, that, wow, I didn't think I was going to be able to transition. There is a certain beauty to moving in a small team and moving very quickly. I love being part of simulation healthcare, being part of IPSS, being part of large organizations. Yeah. There's also a beauty to being in a very small group that just gets things done.
Especially when they need to be done fast.
Yes, when they need to be done fast with not too many barriers. And of course, you have to have a certain level of quality control. Yeah. But having people that are just super passionate about something, that enjoy working at 5:30 in the morning, which I do.
I love that. I don't, but I can work well at 11:30 at night, which I imagine you can, right? So you need people to balance you, perhaps. Yeah.
Yeah. Sometimes we worked. That was actually quite funny when we worked with different time zones.
Yes,
so there were
across the world.
Where there were basically work groups across 24 hours because everybody has a allotted time zone. So shout out to Gita.
Yes, or the folks down under. Yeah, coordinating time zones, very hard across the world. Yeah, and I think that's a really interesting observation, that the skill of moving things quickly, and in simulation, it's something that we aren't necessarily new to us, right? As technology developed, although it didn't move as fast, I feel that now, as we're in simulation, things are moving even faster. It's like light speed. Every day there's something new that I'm hearing about, particularly in the area of, I would say, initially it was virtual simulations or virtual reality simulations, to not confuse with distance sim. But recently it's been AI. I saw this reel, and it was so spot on. It was an ad for some AI product, but they had people in different settings in offices and in healthcare spaces, and they're all talking, but the only thing coming out of their mouth is AI, 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 AI. And that's how it feels right now. I'm like, oh my gosh, like everyone's saying it, but not everybody knows what it means and what are we doing. I'm curious to hear a little bit more about your experience and the skills that you brought with you from having done such an incredible job with this distance collaborative and really streamlining the things that were being done in that space, how that's transferred to our current times, and if there's work you're doing in this space now.
I am. I will say that I started becoming very passionate about those pop-up quick collaboratives that get things done when things are changing so quickly. I have realized that I don't have to be an expert on the particular technology that is coming out, because who really is, right? The computer scientists look at it from the computer science side. We look at it from the simulation side. So I just shook off all those insecurities about how much I need to know and just dove in and thought, you know what, I probably helpful with. It could be just getting something else off the ground, which is why Amar Patel, Maria Bajwa, Janice Palaganis, and myself founded another collaborative, which is called
I love that. I love that.
Let me see if I can get the name right. The AI Healthcare Simulation Collaborative.
Perfect, right?
Yes.
Yeah, I really like that. It's hard in simulation. We're like, well, and in medicine or in healthcare and all our different disciplines, our listeners are from across the world, across disciplines, different professions. And what I heard you say is, one, you don't have to know all the things about all the things, but you have a skill that you brought, the skill of being able to bring the right people to the table, to a small enough team where you can work effectively, but a big enough team where you have all the different expertise you might need. And that's the skill you brought was, hey, we can form a collaborative. I know how to do this. So that's really cool. So you established this collaborative. I'm excited. I want to hear more.
Yes,
so tell me more about what you all are doing and how that's going.
How this one all started, if I reflect on this, I need to think about this. I think it started out of the SSH task force for AI simulation. At least it was closely related, I would say, because that's how Amar and I connected, and then we connected with a lot of AI enthusiasts from the simulation space. This collaborative specifically is trying to really bring all the different disciplines together so that we can work together, learn from each other. What I mean with that is, in this collaborative, we have a collaboration between educators, researchers in the simulation space, but also computer scientists, legal, industry, what else? Ethics. So it is really important because we wanted to make sure are all the new gadgets that are coming out coordinated with what we truly need. That was that initial task force that we were tasked with, and we published a white paper and all these other things. So, and now what we're working on is really becoming a collaborative that basically functions as a clearinghouse for everything AI simulation related. Because if you imagine how quickly we had to move doing distance sim, every week things were coming out. Same for AI. It is so important that we talk to each other and that there is somebody that is laser focused on all those new technologies and also making sure we look at it from all those perspectives, legal, ethics, computer science, bringing everybody around a table. We also now have our own journal, I would say, which is, it's one of the curious channels.
Yes. That's right.
Within the Journal of Curious Computer Science and actually biomedical engineering. And we are the sort of outlet of the collaborative, so that same here. We can't afford right now to have a paper sit on reviewers' desks for a year and then we resubmit it elsewhere and we resubmit it elsewhere. So it is very important that we have high quality, right? So we do have a board of directors. We have a strict process on how things move forward, but everybody is quick, enthusiastic. This is what we do. So it doesn't have to go through a huge organization that moves slowly, that has board meetings every 2 to 3 months. That's not us. Quickly.
I love that, right? You think about, and I love, so you even have a space where people can publish quickly, which is important, like you said, right? You do a project and then the whole technology is immediately changed. And the goal of research and publishing is to help move the science forward. So you want to be able to share it. And as people are working around the country on different things, for them to see, hey, this person did this, let's build on that rather than do the same thing or reinvent the wheel. And so you're helping to do that. You're literally helping to push the barriers and move that science forward by helping people share their work and what's being done. I think that's just brilliant. So tell me, are you working on any of your own projects, or have you done any of your own projects using AI in simulation? And what's your experience been?
Well, who hasn't? Let
That's
me ask
true.
the audience.
Who hasn't tried? Maybe
We're
I'll
all
say.
playing around with it, right?
We're trying to figure out. Yeah.
I'm very interested, mostly I'm very interested in the idea of how to do research, how to conduct research well. So we do have some projects that are ongoing on that. And we have some team members that are really invested in making sure we have the adjusted reporting guidelines, that we have really an agenda on what do we want published and how do we want things published. I also have my little projects. Last year, I mentored Yuri Hong doing a project that she was doing on AI-enhanced debriefing to decrease mental load. What I love about that publication is that Yuri is actually a computer scientist. She does have some experience within the world of healthcare simulation, but she's not medical at all. So seeing her perspective on how she approaches any sort of research really was eye-opening for me. And we are now collaborating on yet another project. And I hope that we will continue collaborating over the years.
I love that. Yeah. I think that, my role currently is very much focused on interprofessional education.
Mhm.
And I think, it can mean a lot of different things when you say interprofessional. Oftentimes we talk about between disciplines of like physicians and nurses or respiratory therapists, pharmacists, but also interprofessional across like someone who has a completely different frame, right? Computer scientist. I work closely with folks that are in human factors,
That's
and
so
just
interesting. I love it.
talking to them about things is just so different, right? Their frame, and then you're like, oh, I didn't even think about that, or that's a blind
Yes.
spot for me, or thinking about where the intersections are. Like, well, this seems kind of like something I've done that intersects with something they have experience with. And
Mhm.
so it's really important, especially in something that's moving so quickly, like AI,
Yes.
for you to make sure you have those perspectives and you're working with a computer scientist or a programmer or whatever that is.
And I really think, and that's a message I wanted to make sure that you hear, being a female in this space
Mm.
and having my own insecurities about things, nobody really has this figured out. I want to make sure you all know this. Nobody has this truly figured out. And
Yeah.
I've now worked with a lot of AI experts and a lot of fantastic scientists in the space of AI. There are still new softwares coming out that not
Yeah.
everyone is aware of. And also the use of how do you use it and how do you appropriately use it. It is way too much for us to all know this. So that's why the collaborative approach is so important. I would encourage, if you're interested in it, meet with others, create a group that is really
Mhm.
supporting you. It is very easy to feel overwhelmed and to feel
Yeah.
like I can't keep up with all these
Yeah.
new technologies. I have news for you. Nobody can. It is very easy to think that you cannot start anything before you're the expert on it. We're all winging it.
We're all winging it. Isn't that life? It's like it's
That's
everything.
so true.
I tell my residents that, my students that, although winging it with more experience sometimes is a little easier than with less experience, but we
That
are
is
all
true.
winging it, right? And we are all learning as we go. And I think learning is humbling, and going into a space where things are moving rapidly and you maybe don't know a ton just yet can be intimidating. But what I hear you saying is do it anyway.
Do it anyway.
Yeah.
And I heard actually a quote today from somebody that said, I love that quote actually, that it was about physicians, but I think it works for simulationists as well. So let me see if I can edit it to simulationists. So simulation educators will not be replaced by AI.
Mm.
Simulation educators not using AI will be replaced by
Yes.
simulation educators using it. So keep that in mind.
Mm.
If you are
Mm.
open to it and try to stay somewhat current, even if you only know 10, 15% of the
Mhm.
options that are
Mhm.
out there, you will still be fine. And you don't have to be so stressed over, oh my gosh,
Mm.
are we even going to be needed in 10 years? You guys are listening to this, so I think you will be needed for 10 years.
You will be needed, but you're going to have to know how to use newer technologies
Yeah,
to believe
I
in
would
you.
encourage you to stay open
Yeah.
to it and try not to be overwhelmed. Just try things out, click through things. It's not magic. It's not as magical as it might
Yeah.
seem in the beginning.
I'll also say, I think that I love that advice, right? Like, don't be too intimidated. Try it out, figure it out, play around with it. I also think the piece that I struggle is, well, if somebody's already doing that, and I always feel like, well, am I too late to the game? Or people are already, maybe I missed the boat. And what I think I'm realizing, and I'd love to hear if you feel the same, there's so much that can be done. So even when you feel like, well, I had that idea, but somebody else is doing that, like say it's AI with debriefing or whatever that is. Every day something new comes out, and what I've realized is there's so many, we don't know enough, and so there's plenty of opportunity to do research to better understand where are the spaces where using an AI tool can enhance simulation, and there's a variety of things that we still need to learn about, and so try it out.
Try it out and make it work for you, because I
Yeah.
think it's easy to
Yeah.
feel that AI is ruling you. It should be the other way around. It should be helpful to you in the clinical space. Optimize how you use your AI supported note writing. Optimize
Mm-hmm.
it how you
Mm-hmm.
need it. Really, I would encourage everybody to really try to at least get basic experience with prompting. Take a little workshop. At all the conferences, you will see that they have keynotes about AI, and it's like, oh my gosh, I've heard enough AI today, right? It is useful though, and I feel like almost you need to be on the other side, if that makes sense, right? Like in the beginning, you might feel intimidated, and once you learn and experience more and more and more, and then you're suddenly the person that people go to and ask about it. It's really worth it. Even if you don't really feel passionate or interested in AI, it's going to be something you will be expected to be very comfortable with in a few years.
Interesting. Yeah, I think that's important. I suppose
it's just my opinion, but
yeah, I think that is how everybody's feeling right now. And it's helpful to hear it's possible to get more comfortable with it, to understand it, and to think about the ways it intersects with the things you're already doing is what I hear you saying, right? Make it work for you. And so if you're a simulationist, depending on what are the spaces you're in, where's your focus, and think about, okay, where does it fit there instead of thinking of it as a separate entity. Right.
Absolutely.
So if you're already doing work in, say, assessment or in transfer of learning or in interprofessional education, which is like what I'm doing, think about where will it intersect in your own spaces and make it work for you.
That is so true. And that I just wanted to mention as well, that initially, when I told people that we're founding this new collaborative, people were like, okay, so it's just like the distance sim one, right? Distance sim is also here to stay, right? It's still being used, even though most of you guys might not be using it. It is being used still. And now at least we have much more learning in how to use it appropriately. I think that I predict that AI will be different. I think AI is truly...
You read my mind. I literally was like, I thought that's what I was going to say. And then I was like, well, that's not what I want to say, because distance sim isn't necessarily continuing. So you answered a question I didn't ask, but I thought.
Oh my God, we're so aligned here. I think that AI is not just here to stay. I think AI is going to transform our lives. That sounds very big, but it is. Yeah. It's going to transform simulation. Because I have gotten that feedback sometimes that people are like, okay, so now you have this AI collaborative. What's next? I think AI is different. I really do believe it. I think it is permeating our lives in so many different ways. Not just here to stay, but it's here to transform. I don't think I can even predict how I think simulations will be like or feel like in 10 years.
Yeah, that's an important take on that, I suppose. And it's hard for any of us to know, but it's good for you to be inside that and the work you've been doing and the people you've been working with to say, hey, I think this is where it's going to be a big deal, and we should all get familiar with it and figure out how does it fit in the things that we're doing and working on. I really appreciate that. Is there anything else that we have not talked about or haven't brought up that you want to make sure we chat about today?
I think we could chat for another hour
and
a half. We could
chat forever, yes. But as it relates to this kind of topic...
I think this pretty much concludes it. If any of you are interested in simulation AI or distance sim or anything I mentioned, I love it when people reach out to me. So feel free to. I don't know if you have notes or something.
We do. We'll put your information. We'll share your email if that's okay. Or
absolutely,
they can always look you up and they can find you.
My email is not secret. It's everywhere. Literally, when you Google yourself, it's everywhere.
Do you get inundated with people like, hey, I want to work with you, Dr. Gross?
Yeah, I would love it.
I love that. Excellent. Well, thank you again for coming on this episode with us. It was really awesome to have this conversation with you.
Thank you so much, Samreen, for having me. This was very exciting for me as well. Can't wait to meet everybody out there.
I love it. You're going to get inundated. We're going to put your email in the show notes, and it's going to be amazing. Lots of collaboration. Thank you for listening to this episode of the IPSS Podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.